But genes don't cause disease. 75 to 80% of the diseases we get are not because, there's some like cystic fibrosis. If you've got the genes for that, unfortunately, there's not much, that can stop the development. But if you have the genes for Alzheimer's, it doesn't mean you're getting Alzheimer's. It means you're vulnerable to getting Alzheimer's. That genes load the gun, but it's lifestyle that pulls the trigger.
Ah, that's a good analogy.
When you have that leaky gut, now these big molecules get into the bloodstream, that gives you number 5, systemic inflammation in the bloodstream. The whole body, the bloodstream is carrying all these inflammatory molecules, and that's what pulls on the chain, and whatever the weak link is, that's where the link's going to break. Now you get elevated antibodies to your thyroid or to your brain or to your joints, wherever the weak link is. And then eventually you start getting symptoms of poor functioning thyroid or depression or anxiety or schizophrenia or rheumatoid arthritis. Eventually you get the disease, and then you go to the doctor and they give you a diagnosis and you think you just got rheumatoid. No, it began 14 years ago. So the goal is increasing healthy lifespan. That's the goal.
Exactly.
And when you focus on increasing healthy lifespan, you start asking different questions. You start asking the questions, well, wait a minute. Okay, so 14 of the 15 top causes of death are chronic inflammatory diseases. And inflammation is an activated immune system trying to protect me. Then the million-dollar question is, what is it trying to protect you from?
So also, can you help us to understand that, once we start detoxing, I suppose, the body from these chemicals, or agents, so do you see that patients start improving and actually correcting or curing the autoimmune disease?
Oh, goodness, yes. Yes. The goal is to arrest, and what the researchers say in many different papers, you can arrest and often reverse autoimmune diseases. But first, we want to arrest it. We want it to stop progressing. We want to lower the antibody load. And to do that, you have to identify why is the body making antibodies to the thyroid in high levels, or to the brain, or to the joints, or to the gut? Why is it doing that?
Cures, Remedies, and Beyond podcast with Dr. Irina, a Stanford-trained medical doctor, inventor, and a published author with over 30 years of clinical experience, is bringing together the science of medicine and the art of healing for ultimate vitality and health. It engages in discussions with healthcare providers, wellness experts, innovators, philosophers, spiritual and industry leaders, as well as health and wisdom seekers to provide you, the listeners, with practical tips and knowledge to help optimize your health and well-being. The Cures, Remedies, and Beyond podcast with Dr. Irina.
Today, our topic is autoimmunity, gut health, and inflammation. Over the past few decades, there has been a dramatic rise in autoimmune diseases. So much so that even the Mayo Clinic has called it an autoimmune epidemic, urging increased research findings, improved diagnostic tools, and more comprehensive prevention strategies. In the United States alone, more than 15 million people are affected by at least one autoimmune disease, and many live with more than one at the same time. Another interesting statistic I found is that prevalence of anti-nuclear antibodies, or ANA, a key biomarker of autoimmune activity, often tested by primary care doctors with a simple blood test, has nearly doubled over the past 30 years, with an almost 300% increase among adolescents aged 12 to 19. Standard treatment often relies only on symptom control, using very strong pharmaceutical and biologic drugs, many of which come with serious and potentially dangerous side effects that can significantly impact patients' quality of life and in some cases even shorten it. What's most important is that many of these health issues can be detected much earlier and they can start earlier, long before the full disease sets in, and they can often, of course, be prevented. This is exactly what our guest has dedicated most of his long medical career to, spanning over 45 years, if I understand correctly. And I'm so happy and honored to introduce Dr. Tom O'Brien. You're an internationally recognized expert in functional medicine, the author of 2 national best-selling books on brain and gut health, and I love your latest book. So it's really fantastic information, packed with information. So you're also a creator of global health summits and docuseries that have reached millions worldwide, educating both doctors and patients about root causes and triggers of chronic diseases, which is why you are often called the Sherlock Holmes of chronic illnesses. I love it. So you often say chronic disease doesn't start at diagnosis. So
Yes.
where does it actually begin?
Well, thank you so much for the invitation to be with you today. And I think this is such an important topic about the increasing autoimmune disease epidemic that we have. Actually, it's a pandemic. It's worldwide. And we think an autoimmune disease begins when your doctor tells you you've got rheumatoid, or you've got multiple sclerosis, or you've got psoriasis. That's actually the end stage. And it's called the spectrum of autoimmunity. There's a spectrum, and it starts when the immune system starts attacking your own tissue, meaning that you have increased antibodies to your own tissue. And I'd like to go back a little earlier than the autoimmune spectrum so that all of our listeners can have a big picture overview, if
Yes,
that's
please.
all right.
Oh, absolutely.
Mrs. Patient, your immune system is the armed forces in your body, the Army, the Navy, the Air Force, the Marines, the Coast Guard. We call them IgG, IgA, IgE, IgM, cytokines. There are many different branches to the armed forces, but they're the armed forces. They're there to protect you.
Right.
So the million-dollar question is, when the armed forces get called out, when you've got elevated ANA antibodies, which is anti-nuclear antibodies, which means the immune system, the antibodies are attacking the nucleus of the cell, inside the cell. Well, what cells? Any cell in the body. Neurological, gastrointestinal, dermatological, it doesn't matter. Your thyroid, your brain. ANA antibodies can attack any tissue. So, but when antibodies are attacking the tissue, the question is, what is your immune system trying to protect you from? And it's being misguided. I'll just give you one example of hundreds of examples. Many people have heard about the dangers of too much of the heavy metal mercury. And it's in some vaccinations, it's in tuna. Unfortunately, most tuna is high in mercury and other large fish, large predatory fish, because the mercury comes down with the rain on the ocean. The plankton, that tiny little green stuff in the water, the plankton absorbs the mercury. The little fish eat the plankton, so they get some mercury. The medium-sized fish eat the little fish, so they get more concentrations of mercury. And then the big fish eat the medium-sized fish. So they get higher concentration. So, and then we eat the big fish like swordfish, tuna, which is usually high in mercury. So when we're exposed to mercury, when the body says, get this out of the bloodstream, get it away from the brain, where does it go? It goes into the nucleus of the cells, any cell in the body. And so your immune system, wait, what's that down there inside that cell? What is that? Nope, that's not the nuclear tissue. There's something wrong with that. Let's destroy that tissue. Let's get rid of that. That's a damaged nucleus. That's a damaged cell. Let's get rid of it. You make antibodies to the nucleus of the cell. That's
Because it was
anti-nuclear antibodies, and it's because there's toxins
right.
that got into the cells, and they're buried in there because we get these minute exposures that we don't have any symptoms to. We don't feel it when we're exposed to it, and it gets buried in our bodies to get it out of the bloodstream, keep it away from the brain. And then it accumulates to the point to where the immune system, the armed forces says, hey, what's that over there? That's not supposed to be there. Now you make antibodies and you refer to them, the A antibodies. I'll give you another example. We know that there's a great deal of toxicity from the category of chemicals called phthalates. Those are chemicals used to mold plastic. And the one that most of us have heard about is called BPA, or bisphenol A, which is in water bottles and contact solution and many other things.
Right.
BPA, when your body can't filter and get rid of it, so it starts accumulating in the blood, one of the places that it gets deposited to get it out of the bloodstream is the thyroid. So your thyroid accumulates BPA. And as it's accumulating this chemical, this bisphenol A, this phthalate, as it accumulates, it gets to the point to where your soldiers that are out there just looking around, the scouts say, hey, what's that over there? What's that over there in the thyroid? That doesn't look like thyroid tissue. We better fight that. Now you make more antibodies to go after the bad thyroid cells. They look like bad thyroid cells. So you make more thyroid antibodies. And it's because of this toxic chemical that got into the body in high enough concentrations so that our detox pathways couldn't get rid of it. So it accumulates. It accumulates in the brain and many other tissues, but there's a number of studies about thyroid. Just Google thyroid
Right.
or hypothyroid or Hashimoto's thyroiditis, which is the name of the autoimmune disease, Hashimoto's and bisphenol A. Here come the studies, and you can read about it. So
That's interesting.
in my book, The Autoimmune Fix, which is it's in 8 languages, which is really great. I'm very grateful for that. And we talk about this, and we talk about it that the rule of thumb is, in God we trust, all others require data. What does that mean? It means you test. You test to see, do I have elevated antibodies to my own tissue? Whether it's my brain or my thyroid or anti-nuclear antibodies. And there are laboratories now that have really good tests, highly accurate tests that will look at 25 or 30 different tissues to see, do you have elevated antibodies to your heart? Do you have elevated antibodies to your brain? There's one test that looks at 53 different markers of inflammation in the brain. And so you run these tests to screen because we're looking for the spectrum of autoimmunity. We're looking for when the immune system is in the earlier stages of attacking its own tissue, the body, in the body. And once you identify it, which tissue is involved, then you say, why is it attacking that tissue? And then the next test we do for people is called the total tox burden. It's a urine test that looks at 18 heavy metals, 28 mycotoxins, which are the exhaust from mold, and 34 organophosphates and other insecticides, pesticides, petroleum-based products like bisphenol A's that can accumulate in the body. So we look to see what's accumulated in the body over the years and now is activating the immune system for this patient.
Wow, yeah, that is so important, as you said, the tasting. And what I really appreciate you have done, basically like a pioneer in the idea of that spectrum, as you said, of autoimmunity, and the concept, of course, that the problem can start developing, silently for years. And then, if we can start, of course, unwinding it early enough, we can prevent the serious damage to the tissue. Because as you said, immune system is our surveillance system. It's trying to help us. It's trying to eliminate either infected cells or, toxically damaged cells, obviously, along the way we have, some additional damage, right? So, or do you call it like a smoke or some? So and so also, can you help us to understand that, once we start detoxing, I suppose, the body from these chemicals, or agents, so do you see that patients start improving and actually correcting or curing the autoimmune disease?
Oh, goodness, yes. Yes. The goal is to arrest, and what the researchers say in many different papers, you can arrest and often reverse autoimmune diseases. But first, we want to arrest it. We want it to stop progressing. We want to lower the antibody load. And to do that, you have to identify why is the body making antibodies to the thyroid in high levels, or to the brain, or to the joints, or to the gut. Why is it doing that? So we don't go directly after the symptoms. And sometimes people are suffering and you really need to give them something to feel better while we're doing this exploration, of course. But you want to identify, why is the immune system activated? It's the most important takeaway from this talk today is you want to find out why this is happening. Why is your immune system doing this? It's not a mistake. Autoimmunity is rarely a mistake. It's your immune system trying to protect you. We have so many examples, case studies of a 64-year-old man who had severe psoriasis for 24, 25 years, came on in his early 40s, late 30s, tried many different steroids and steroid creams and went to a number of different dermatologists, and no one could help him. The kind of psoriasis covering his entire body to where kids running into the elevator and he's in there and they see him and they kind of like
Right.
move away, right?
Yeah.
Because it looks so bad. And we found that he had elevated antibodies to gluten. And turned out he was a celiac that had no stomach symptoms, no gut symptoms whatsoever. And put him on a gluten-free diet, and in 1 month, his skin was completely cleared.
Wow, that
In
is
1 month,
amazing.
after 20-some years of severe scaling psoriasis.
I really loved reading in your book again, so that, which I didn't know, I have to say that, what is it, 1 in every 8 people, so like, celiacs who have, of course, gut symptoms, 1 out of 8 will have something not related to the gut illness, so
That's exactly right. That's
that's really
exactly
was
right. Their
impressing
gut
to
feels
impressive.
fine. They don't
Yeah.
get gut symptoms. They get seizures. 50% of children with drug-resistant epilepsy which means that they've at least been on 3 drugs and they still have seizures. 50% of them go into complete remission, no more seizures, on a gluten-free diet. Now, why don't our neurologists know this? Because that article was published in a gastroenterology journal. And neurologists don't read gastroenterology journals. They read neurology journals. So they don't know. They don't
Yeah.
know. And it doesn't matter what the symptoms are. The most common source of inflammation, the most common source is what's on the end of your fork. That's most common. But I feel fine when I eat wheat. It doesn't matter how you feel. It really doesn't when you eat something, because the symptoms may be seizures, or it may be ringing in your ears, or it could be arthritic pains, or it could be multiple sclerosis, but there's no gut symptoms. But you get the food out of there. Once you find out that your immune system is fighting the food, you get the food out of there completely, no cheating. There's no such thing as a cheat day. And if you want, we'll talk about physiology of why that's so. You completely eliminate the food. And the result is, the rule of thumb is, you should be feeling better. You should notice some change for the better within 3 weeks. I don't care if you've got stage 4 cancer. You should notice that you're feeling a little better. You're sleeping a little better. The intensity of the pain is down. It's not constant. It's sporadic. Something. You should notice something within 3 weeks. If not, we missed something.
And that is because through the gut, excuse me, we have a leaky gut, obviously, problem, right? So, and there is sort of like a microsepsis that is constantly occurring in the bloodstream because of the
Exactly.
poorly digested protein and other substances that we ingest. So, and they start irritating, so the immune system, if you will, right? And the symptoms can be silent on the gut side, but, obviously we know that 70 to 80% of, brain functional, neurotransmitters, even generated and secreted by gut now. So, and brain
Yes,
disorders are related to gut.
the ratio is 9-1. And it was Professor Michael Gershon, I think he was at Princeton. He wrote the book in 1997, The Second Brain. And he told us in that book, it's a great book to read for the general public. He told us that for every 1 message from the brain going down telling the gut what to do, there are 9 messages from the gut going up telling the brain what to do. The ratio is 9-1. So we've known that for over 20 years now, almost 20 or 25 years. We've known that the gut, and the geek term is called modulates. And all that means is has its hands on the steering wheel. So the gut and the exhaust from the good bacteria in the gut and the bad bacteria, that exhaust, they're called short chain fatty acids, but they have their hands on the steering wheel of how many brain hormones called neurotransmitters are produced. What percentage of this hormone or that hormone? All of that is controlled, hands on the steering wheel. All of that is controlled by the bacteria in your gut. So just like when you're driving a car, if you turn the steering wheel just a little bit to the right, 50 yards, you're off the road. So when you've got too much of the bad guys in your gut and not enough of the good guys, the messages going up to the brain are off the road to health. And now you go into dis-ease. Something's not working right. You get a little depression, you get a little anxiety, you've got some attention deficit, or much worse, of course. But it starts with just a little bit of off the road. And here's a concept that I think can be very helpful for your listeners. Professor Alessio Fasano is a professor of medicine, Harvard Medical School, a professor of nutrition, Harvard School of Public Health, the chief of pediatric gastroenterology at Mass General, Harvard, the director of the Celiac Research Center, Harvard, the director of mucosal immunology, that's the lining of the gut, the lining of the brain, the lining of the lungs, Harvard. This guy has 5 titles. Any one title is a lifelong dream for someone at the top of his game. He's got 5.
That's
We think
impressive,
he's going to
right?
win the Nobel Prize. We do.
Oh,
Because it was him and his team that identified the mechanism that causes this thing that we now know as leaky gut. They did that in 1997. And for the last 30 years, he's been writing about it. Leaky gut and pancreatitis, leaky gut and cancer, leaky gut and diabetes, leaky gut and depression, leaky gut and schizophrenia. There are hundreds and hundreds of studies published. Professor Fasano has his name on I think it's about 380 different studies now. And there are many other authors writing about this. But you'll see an article, and there are 8 authors on the article in the Journal of the American Medical Association. And the last author, Alessio Fasano, the boss, the
right.
stamp of
Right.
approval. Yeah, this one's ready to go. And he's so careful about what he says, always. This article he wrote himself, which gives you a sense of the importance of this article. And every practitioner needs to read this article. Every doctor, every healthcare practitioner. The name of the article? All disease begins in the, quote, leaky gut. The role of the protein zonulin, which causes leaky gut, in the development of chronic inflammatory diseases. And he talks about all disease begins in the leaky gut, all of it. And wait, that's an exaggeration. No, this is the chief of pediatric gastroenterology at Harvard. No,
Wow.
this is no exaggeration, right? And you read the article and you understand, and he calls it the perfect storm in the development of autoimmune diseases. There is a perfect storm. There are 5 parts to the perfect storm. And when you understand this, and my book, The Autoimmune Fix, is all about this. And that's why I won a National Book Award, because I was able to explain it in everyday terms. And people go, wow, this just makes sense. Okay. And then we did a docuseries where I traveled the world and I interviewed 64 of the world experts in autoimmunity. I went to Germany, I went to Israel, I went to London to interview world experts, and we put it together. It's a docuseries on our website. It's free, and it's called Betrayal, the Autoimmune Disease Solution They're Not Telling You. And when you register for this, we send you an episode every day for 9 days. It's about an hour, a little bit less, and you watch it. Wow, that just makes sense. That really makes sense. And you hear it from the world experts. So
That's
what's the
remarkable.
perfect storm?
Yeah.
What's the perfect storm in the development of chronic inflammatory diseases? 5 parts to it. Number 1, genetics. That's the deck of cards you were dealt in this lifetime. Can't do anything about your genes. But genes don't cause disease. 75 to 80% of the diseases we get are not because, there's some like cystic fibrosis. If you've got the genes for that, unfortunately, there's not much, that can stop the development. But if you have the genes for Alzheimer's, it doesn't mean you're getting Alzheimer's. It means you're vulnerable to getting Alzheimer's. That genes load the gun, but it's lifestyle that pulls the trigger.
Oh, that's a good analogy.
Yeah. So number 1 is genes. So it's always good to find out what your vulnerabilities are. One more thing to say about that one. Mrs. Patient, if I pull at a chain, it always breaks at the weakest link. It's at one end, the middle, the other end. It's your heart, your brain, your liver, your kidneys. Wherever your genetic weak link is, that's where the chain's going to break. Well, okay, but it's the pull on the chain that eventually causes that link to break. And what's the pull on the chain? The pull is inflammation. It's always inflammation. 14 of the 15 top causes of death, according to the CDC, are chronic inflammatory diseases.
Right.
Every autoimmune disease is a chronic inflammatory disease. So genetics set you up for a weak link, but you can't do anything. Yeah, maybe you can strengthen the link a little bit, maybe. But the key to not getting that disease that your genes say you're really vulnerable to, stop pulling on the chain so hard, right? Stop the inflammation. But to do that, you have to ask the question, what is my immune system trying to protect me from that is producing so much inflammation?
Right.
This is like basic 101 simple stuff. It's difficult to identify it all, but the concepts are not that difficult, and they just make sense for the vast majority of patients. This is exactly what they need to do. So number one is genes. Number two, let's see. Number two is too many bad guys, not enough good guys in the gut. And the technical term is dysbiosis. From the foods that we eat, the things that we drink, we get too many bad guys down there and not enough good guys. And to give you like a big picture overview, I hope you'll be driving down the road 3-4 days from now, a week from now, you say, wait, what? What did he say? It'll come back to you again. This is Professor Yehuda Schoenfeld, the godfather of autoimmunity. He's at Tel Aviv University in Israel, and he trains medical doctors to get their PhD in immunology. And to give you a sense of who this guy is, last count that I know of, 26 of the medical doctors that went back and got their PhD in immunology, 26, there are many, many more from him, but 26 of them chair departments of immunology in medical schools and hospitals around the world. They're his students. This is the godfather. And he and I shared the stage in Rome last November.
Oh, wow.
And we had lunch together. I said, Professor, how are you? And he looked at me and he said, we are born 99% human, which means, that with newborns, maybe 1% of the cells in their body are bacteria. All the rest of it, they're all human cells. We are born 99% human, and we die 90% microbial.
Oh, wow. That's amazing.
And Dr. Arena, it's true. You've heard that there's 10 times more bacterial cells in our body than human cells, but we don't know what to do with that information. Oh, that's interesting. Okay, so what? But Schoenfeld looked at me and he said, we are born 99% human and we die 90% microbial. And he didn't say anything. He just looked at me for about 20 seconds, and then I said, so Professor, does that mean that the microbiome is really the dance of life? And he said, precisely. That if there's only one thing you're going to do to be healthier, to everyone out there, if there's only one thing, it's learn how to build a healthy, strong, diverse microbiome.
Wow.
Nothing is more powerful than that. Nothing is more powerful than that. Not red laser therapy, not stem cell therapy. Nothing is more powerful than a healthy, diverse microbiome, right? So that's number two from Fasano.
I love that. And then since we're, if you don't mind, so what is your tip for improving the microbiome? Because I know that you're so practically oriented, with your patients, and that's one of your strongest suits, in my opinion. So you always have practical tips, advice. So
yes. There are many steps in building a healthy, diverse. First, in God we trust. All others require data. What does that mean? It means you have to figure out what kind of a microbiome you've got right now. You don't just shotgun. You've got to figure out. You have plenty of this, not so much of this, way too much of this bad guy. You have to test. Don't guess. You have to find out. Then you do laser specific. I don't mean laser. I mean just really focus specific therapies for your microbiome. And there's some shotgun things that everyone could do, like every day you should eat a little bit of fermented vegetables, whether it's kimchi, miso, sauerkraut, something every day, just a little bit, because you're feeding the good guys. And then you have to learn what's the food for the good bacteria in the gut, called prebiotics. And so there's a number of steps to learn. It's in my books, and it's not a 30-second answer. But that's number 2. Number 1, genetics from Fasano in The Perfect Storm. Number 2 is dysbiosis, too many bad guys, not enough good guys in the gut. That's number 2. Number 3, that dysbiosis in the gut creates leaky gut. Now, Mrs. Patient, your digestive system is a tube. It goes from the mouth to the other end. One big, long tube. So when you swallow food, it's really not in your body. It's in the tube. How's it going to get into the body from the tube? Well, it's got to go through the walls of the tube. So you take a bite of a hamburger. That can't go in your bloodstream. It'll kill you. If it did, it'd be very toxic. That it's got to be digested and broken down. If you think of a raspberry, there's lots of little parts to raspberries. They all look the same. Digestion is breaking down your food into each little part, called an amino acid. Looks like a raspberry, a little piece of the raspberry. And when they get small enough, they go right through the walls of the gut into the bloodstream. Great. That's absorption. But when you have a leaky gut, see, the inside of that tube is lined with cheesecloth, so that only really small molecules, after they've been broken down, digested from that big piece of hamburger down to each little piece of the raspberry, now they go right through the cheesecloth into the bloodstream. And that's how we absorb our food. But what happens if you get a tear in the cheesecloth? We call it leaky gut. Now, bigger pieces of food get into the bloodstream that aren't supposed to get into the bloodstream as big pieces of food. They're called macromolecules, big molecules. Now they're in your bloodstream, and your bloodstream's just a highway. It's all going in one direction, but there's all kinds of traffic on that highway. But now you've got these macromolecules in there that aren't supposed to be there. And your immune system, that's the leaky gut, right? And then your immune system looks at, wait, what's that in the bloodstream? What is that? That looks like a big piece of beef or something. Boy, we better fight that. Now you make antibodies to beef. And these are the people that do a 90-food blood test to see what they're sensitive to. And they're allergic to 30 different foods. And they say, oh my God, that's everything I eat. Well, of course it is, because you've got leaky gut. You've got lots of macromolecules that are getting through into the bloodstream, right? Heal the gut, wait 6 months, then go back and test again. Now you're sensitive to 2 foods, maybe 3. Those are the ones you stay away from permanently, right?
Right,
So,
because when we eat and we properly digest all those small, as you said, raspberry bits are amino acids that we obviously need because they're the building blocks of the tissue and the body, and we need that. So, but when they become bigger because of the leaky gut and the digestion is off, obviously, and not properly working, so then our immune system doesn't recognize it as normal and starts basically, attacking and saving us from something, the immune system doesn't recognize, right? So, and that's what you're talking about.
that's exactly right.
Yeah.
Exactly right. So, number 1 was genetics, the weak link in the chain. Number 2, I'm sorry, I said it backwards. Number 2 are environmental triggers. What we eat, what we drink, the air we breathe. And it's the environmental triggers that cause number 3, dysbiosis. Too many bad guys, not enough good guys in the gut. When you have the dysbiosis, and now these macromolecules get into the bloodstream and your immune system fights them, that gives you number 4, which is leaky gut. When you have that leaky gut, now these big molecules get into the bloodstream, that gives you number 5, systemic inflammation in the bloodstream. The whole body, the bloodstream is carrying all these inflammatory molecules, and that's what pulls on the chain. And whatever the weak link is, that's where the link's going to break. Now you get elevated antibodies to your thyroid or to your brain or to your joints, wherever the weak link is. And then eventually you start getting symptoms of poor functioning thyroid or depression or anxiety or schizophrenia or rheumatoid arthritis. Eventually you get the disease, and then you go to the doctor and they give you a diagnosis and you think you just got rheumatoid. No, it began 14 years ago.
14
Now we know
years
there are so many
before, wow.
studies. We know when you have elevated antibodies to your own tissue, we know about how long it's going to be before you get the diagnosis of an autoimmune disease. With rheumatoid, it's 14 years. With diabetes, it's 12 years. With Hashimoto's thyroid, 7 years. Celiac, 7 years. So if you've got elevated antibodies and you just got elevated antibodies to your thyroid, if you don't stop the mechanism, arrests the development. If you don't stop that mechanism, in 7 years, you're likely to have Hashimoto's thyroid disease.
Oh, wow.
And some of them, it's 100% positive predictive value. You're getting lupus, or you're getting autoimmune disease of the thyroid or of the liver. And we know about how many years you'll have elevated antibodies killing off tissue before that tissue can't function normally anymore. Then you start getting symptoms. And
Wow.
so that's all laid out now. It's in my book, The Autoimmune Fix. We talk about it in Betrayal, the autoimmune disease solution they're not telling you. We talk about all these concepts with the authors of the studies that introduce the science to us from all over the world.
That is really impressive. And of course, as your latest books indicate, so that with the leaky gut, then, the next thing is a leaky brain, right? So
That's right.
And obviously, it's an epidemics of the different brain disorders, from Alzheimer to anxiety and other multiple mood disorders, etc. So, can
I'm
you?
I'm going to shock you here. The paper came out last year. Every child they've checked, every child in metropolitan Mexico City by the age of 14 has evidence of early Alzheimer's. Every child.
What?
Because the air pollution is so bad. And when you breathe the air, it goes right up your nasal cavity, right up past the memory center of the brain, and creates the inflammation in the memory center of your brain, and you start losing your memory.
Wow.
Every child.
Interesting. In the limbic system, and oh wow, that
Yes.
is unbelievable.
Yeah. I mean, it's so bad, and no one's talking about this.
Wow.
And
So,
New Delhi, I'll be going to India to give a couple of talks later this year. New Delhi, their air is 14 times worse than metropolitan Mexico City.
oh wow,
So they're much worse, but no one is measuring the kids there. No
right.
one's measuring to see the impact.
That is unbelievable. So, in your opinion, what are the few top triggers that cause all of that leaky gut, leaky brain? So you mentioned the environmental toxins, the air
Yes.
we breathe. So, any specific foods? You said it's at the end of your fork. So, what would you suggest people to eliminate just as even trial to see if they can have
Yeah,
improvement
now
in their
we've got to get
symptoms.
past this idea. Try this and see how you feel, because it's not going to stop the mechanisms that are going on. They feel a little better for a while, then it's their daughter's birthday, so they're going to cheat. They're going to have a little bit of the cake, or we've got to stop thinking that way. Well, tell me what I can do right now so I can feel a little better. That's important, but you have to understand, if you don't stop the mechanism, you're going down. Excuse me, but we can't keep looking for the quick fix. It doesn't work. The epidemics of autoimmune diseases, as you said in the beginning, keeps going up and up every year. It's 4 to 9% a year increase in every autoimmune disease. 4 to 9% a year, every year. That means in 3 years, it's 12 to 27% increase. In just a couple, this is
Unbelievable. Yeah,
yeah,
it's
it
unbelievable.
is. It really is. And when you start testing, see, if you go to my website, thedr.com, thedoctor.com, just don't spell the word doctor out, you can see these tests. And I recommend everyone download the information about these tests. The Autoimmune Zoomer that looks at over 30 different autoimmune mechanisms, and take the information to your doctor and say, please order this test for me. Please order this test. And if they say no, then order it on my site, and get the information, find out what's going on for you.
It's called
Then
Zoomer test, right? So
the
you're saying,
Autoimmune Zoomers, yes.
oh, that's
And,
great. So
and then
you
the
basically
total
say, oh, sorry. Mm-hmm.
and then the total tox burden is the urine test that looks at how many
Okay.
toxins are in your body that aren't supposed to be there. And you'll be shocked, I promise. Everyone is shocked when they see, wait, what? What? And these tests are very, very accurate. And the wheat Zoomer, it's an excellent test because it also identifies leaky gut. And when you do these tests, then there's a bunch of tests there, but when you do these tests and you find out what's really going on right now, then now you know where to focus your attention on learning how to fix the problem that you've got.
I like that. So basically, you're saying that it's very much personalized. So, don't use just generic kind of approach, but go and test, see what's your specific profile, what's your specific, toxin sensitivities, etc. So, and then address, your own,
That's
body and
exactly right.
biochemistry.
That's exactly right. Look,
Mhm.
the average lifespan for men is about 78. The average lifespan for women is about 83. But the average healthy lifespan for men and women is 62.
Oh,
Meaning
wow,
after
really?
that, you've been diagnosed with a disease and you're on some medication. And
Hmm.
so my goal, Mrs. Patient, I don't know if I'm going to help you live longer. I don't know. We'll find out when your life is over, how long you lived, we'll find out. But I certainly can increase your healthy lifespan so that it's closer to your total lifespan. So your period of disability, if any, is very small. We certainly can do that. Lots of science for that, a lot of science. So the goal is increasing healthy lifespan. That's the goal.
Exactly.
And when you focus on increasing healthy lifespan, you start asking different questions. You start asking the questions, well, wait a minute. Okay, so 14 of the 15 top causes of death are chronic inflammatory diseases. And inflammation is an activated immune system trying to protect me. Then the $1 million question is, what is it trying to protect you from? And then when you eliminate or reduce your exposure to wheat or to mold or to heavy metals or or organophosphates, listen to this study. This one is jaw-dropping. In the Journal of the American Medical Association, they published a study from Harvard, and the editors of the journal made a comment. They said, this is an elegant study using sophisticated biomarkers to demonstrate their point. And Dr. Arena, that the editors of the Journal of the American Medical Association don't say things like that very often. They don't give a stamp of approval. There's so much politics in all of that, but they
Right.
did here. Okay, so what was the study? They looked at women at infertility centers, and they ruled out all of the known risk factors: alcohol, cigarettes, obesity, exercise, no exercise, socioeconomic class, race. They ruled all of that out, and they looked at one thing, and they did it in such an elegant way that no one can argue with this. What did they look at? How many servings of fruits and vegetables was the woman eating a day while she was trying for implantation? They
Really?
divided the women into fourths. The lowest number of servings of fruits and vegetables, the next, the third, and the highest. The results were shocking, completely shocking. No one could believe it. Women in the highest category of fruit and vegetable consumption compared to women in the lowest category of fruit and vegetable consumption per day, women in the highest category had an 18% less likelihood of successful implantation. Wait, what? The
Wow.
more fruits and vegetables they ate, the worse the outcome? Yes. And
How
if
come?
they did get pregnant, they had a 26% increased risk of miscarriage.
Hmm.
The more fruits and vegetables they eat, the worse the outcome.
Is it because of the pesticides?
Exactly. Because there was a small group of women in the study who were eating organic. And in that category, the results were the exact opposite. The
Mm,
exact opposite. The more fruits and vegetables, the better. But because women
amazing.
and men are so full of accumulated toxic chemicals, just a little bit on a daily basis from eating tomatoes and lettuce and cucumbers, of the pesticides and insecticides, that was enough to prevent them from being successful with implantation or having a healthy pregnancy. That's how polluted we are today.
Yeah, that's unbelievable statistics, obviously. So, and
And
people are
the
not aware.
editors
Yeah.
and the editors of the journal gave the stamp of approval. They said, an elegant study using sophisticated markers to demonstrate their point with startling results. We never would have believed that. But
Yeah.
that's the case today. There are so many toxins that are causing the autoimmune diseases, that are causing the infertility, the miscarriages. There are so many toxins we're exposed to that are just accumulating in the body, and you feel fine because you've learned how to survive and be as happy as possible with the way your body's functioning.
Hmm. Yeah, I never even realized that the statistics is so staggering. But
That's why the total tox burden is such an important test,
yeah,
because it's jaw-dropping when people see how many toxins are in their body right now.
yeah. So, in the general, of course, recommendation is to eat organic and farm to table, right? So
And if
fresh.
you cannot eat organic, and this is all in my books, but if you can't eat organic, you go to trulyfree.com, TRULYFREE, trulyfree.com, and you order their veggie wash. And you come home from the supermarket with the broccoli, you spray the veggie wash on it, you dip it in a tub of water and rinse it off, and you see, oh, look, it's so green now. Because you got the wax off of it and the insecticides off of it. And it's that easy to do. And you do that with your inorganic vegetables, and you get over 95% of the chemicals off of it in 10 seconds. I mean, it's a pain in the butt to do that. It's a nuisance to do it, but that's what you have to do to reduce your exposure, let alone every time you go to a restaurant, you're eating the fruits and vegetables that are high in insecticides, pesticides, fungicides, rodenticides. That's what we're eating in restaurants.
Yeah. The cleaner we started eating, me and my husband, so the more I realized how I became intolerant to the restaurant food anymore. So
Exactly.
it just flares me up and I feel really bad. So even though like high-end restaurants, and go figure, right? So, but that's the case,
Yeah,
of
well,
course.
you live in an area in the Bay Area so that you've got plenty of organic restaurants available to you.
Yeah.
Makes a
Yeah.
difference. But, you can't go to P.F. Chang's. You can't because the fruits and vegetables are so loaded with chemicals now, more than ever before in history. And it's one of the contributors to obesity, to weight gain, is the amount of chemicals that our bodies are holding on to.
Mm-hmm.
But that's a whole nother topic.
Right. So, because a lot of them are, mimicking, our hormones, right, and estrogen, and
Exactly.
etc. So, and that is, becoming a huge issue. So, um, well, I can't avoid, but I want to ask you about your famous applesauce recipe and the reason why you really like it, because you actually mentioned that during our last conference, where we of course talked in Las Vegas at the A4M, or anti-aging world forum. So where you
Yes,
so
yes.
beautifully presented, of course. So yeah, tell us again about that famous applesauce and the reason again, so why you like it and eat it every day, you and your wife.
Yeah, one of the common toxins, the number one cause of death of elders in hospitals is sepsis. And sepsis is an accumulation of these really toxic vests, like you put a vest on to keep you warm, protect your chest. Bad bacteria have a vest that protects them from the immune system killing the bad bacteria. The vest is called LPS, lipopolysaccharides. And LPS accumulates in your body, in your liver, in your brain, in your kidneys. LPS is the primary reason that our brains produce beta amyloid, the marker of Alzheimer's. It's
Really?
an immune defense against LPS that got into the brain through a leaky brain.
So it's a
And
body's protective approach again, just as
that's right. That's right,
to
because
eliminate those.
that's exactly right.
Wow.
Exactly right. So this LPS is nasty stuff. It accumulates in your body. You don't know it's accumulating. Uh, and our bodies don't have a lot of defense against it. They've got a few defensive mechanisms. The primary one is something in your gut called intestinal alkaline phosphatase, IAP. Really great enzyme, arguably the most important enzyme in the gut because of all the things it does for us. But IAP grabs onto that vest from bad bacteria and it won't let go. So that bad bacteria just gets escorted out with the poop. It goes all the way through the digestive system and out with the poop. It can't be absorbed through leaky gut because IAP is holding on to it like a big sponge holding on to it. Well, so you want good high levels of IAP, intestinal alkaline phosphatase, in your gut. How do you do that? Pectin. Pectin from apples will feed intestinal alkaline phosphatase and increase your IAP levels. So in your gut, you've got all this protection to grab this bad bacteria. If you've got this bad, remember it's number 3 in the perfect storm is too many bad guys, not enough good guys in your gut. And so it happens to all of us. So the higher your IAP level, the less of this vest called LPS can get into your bloodstream and accumulate and cause problems in your brain and many other tissues. How do you increase IAP? Pectin from apples. This is why an apple a day keeps the doctor away. This is exactly why. And so you make applesauce. Mrs. Patient, get 15 apples, organic. If not, make sure you wash them really well because apples hold a lot of toxic chemicals. Dice them into pieces, get the seeds out of them, put them in a pot, add water to 1/3 the height of the apple. So if the apples are this high, you add water 1/3 the height. Put some cinnamon in there, maybe a few raisins, turn it on high. In 15 minutes, you got applesauce. That's how easy it is to make applesauce. My wife likes to put it in the blender to make it smooth. I like it chunky. But either way, then you just have a few tablespoons of applesauce, homemade applesauce every day. And it's got to be homemade. The commercial stuff doesn't do it. It's not effective. It doesn't have
And
much
they
pectin in
put
it.
preservatives probably in the commercial one, right? Yeah.
Right.
Mhm.
And so you have a few tablespoons a day of applesauce, homemade applesauce. Well, can I have more? Of course you can have more. Have a bowl if you want, as long as your blood sugar doesn't go yo-yo from it. But having a little bit every day is food for the good bacteria in your gut and food to increase intestinal alkaline phosphatase that grabs the bad bacteria and escorts it out with the poop. And all of
Well,
that's in my books and
yeah.
in Betrayal. We talk about it in Betrayal also.
So simple and, one little step that anybody can even start today, right? So,
Yes,
yeah.
exactly.
I also like what you described in your book here is your smell test, so, and you quoted the research that if someone is 70 years of age or older, and if they lose the sense of smell, so apparently research shows that those people have 48% increase of death from
Yes.
any causes in the next
Within
5
5 years,
years.
right.
Yeah,
Within
that
5
is
years.
unbelievable.
Yeah,
So tell
yeah.
me more about that.
Well, that's pretty much it. When you start losing your sense of smell, it's an indicator of the inflammation in your brain that's killing off tissue. And it's not that your nose has a problem. The majority of time, it's that you're not remembering the smell because those neurons are being killed off in the memory center of your brain. And so the smell test is just a marvelous test. I happen to have one here. I put
Oh,
this
yeah, sure.
together, and this is the smell test. And what you do is you scratch this like a lottery ticket right there. You scratch it, and then you smell it. And the question is, does it smell like tomato, menthol, strawberry, or licorice?
Oh,
And then you
boy.
mark right here which one it smells like. Then you turn the page and you scratch the next one:
It's a
cherry,
multiple
honey,
choice,
lime,
basically.
or whiskey.
Oh, interesting. Okay.
Yeah. And then you mark it on the yellow there, the answer. Then you turn the page to the green page and you scratch it. Is it baby powder, banana, chili, or clove? And you mark it there. And there's 12 of them. And at the end, here's the answers. And so you
Okay.
and so you score it yourself. And if you score 9 or below, you've got hyposmia. You're losing your sense of smell. 9 out of the 12 or below. You're losing your sense of smell.
That is so
And so
interesting.
we said, wait, what? What? And sometimes that's the motivation for people to now do the testing and figure out where's the inflammation coming from that's killing off their brain cells.
Yeah, I like again how simple that is. Wow.
It's a
So you
nice
also,
tool.
yeah, and you also explain the pyramid of health in your book, so which is kind of a very interesting diagram. So would you quickly enlighten us a little bit about this?
Sure. Um, in the world of functional medicine, if you see a 3-sided pyramid, there's actually 4 sides to a 3-sided pyramid. There's also a base, right? You can see 3 sides going up, but there's a base. And you always have to look at health from 4 sides. When there's a health issue, it can be caused, and it's usually caused by a combination, but usually there's one that's dominant. And it could be structure, and that's the base. Structure is exercise, posture, the bed you sleep in, the car seat in your car, chiropractic, massage, uh, and sometimes you get miracles when you work with structure. Sometimes you do. You're just startled by, wow, really? That got better also? Wow, okay, great. Glad to hear it. And then one side of the pyramid is the biochemistry. That's where most everyone spends the majority of their time. What do I take? What do I take to feel better? It's what you eat, you drink, the air you breathe, the biochemistry. The next side of that pyramid is the emotional, the spiritual, which
Oh,
can
yeah.
cause any problem whatsoever.
Yeah.
And the last side, and the newest kid on the block in the last 15 to 20 years, is the electromagnetic. And those four sides, a doctor always has to look from all four sides. And unfortunately, very few doctors are trained this way. They're trained as a specialist in one side, and they're usually pretty good at that one side. But it could be one of the other three sides that's primary. And so, although what they're doing is good rational care, you don't get the results that you want.
Right. Right. That's what we call, of course, holistic approach or functional medicine approach,
That's right.
integrative medicine. Yeah. Yeah. Oh, that's beautiful. So it's also, again, so simple, but encompassing, so to speak. Yeah.
The goal is making it easy to do the right thing. You want to increase your healthy lifespan. You have to do the right thing to do that. Well, how do I do that? Well, you have to find the map. I raised a family and had a practice in Chicago. And Chicago is an easy town to get around, especially if you have a map. It's really easy to get around Chicago. But that map of Chicago does you absolutely no good whatsoever if you're in San Francisco, right? Your friend that has joint pain took this medicine or took this vitamin or did this food or eliminated this food and they got better. Your joint pain can be completely different. That the map
Yeah.
of Chicago doesn't work in San Francisco. There is no shotgun approach that's going to help increase your healthy lifespan and reduce your diseased life, right? There's no shortcut. You have to identify what is triggering the inflammation.
In you specifically, as you said, it's very much personalized. So
That's
yeah.
right.
Yeah.
That's right. It could be structure, it could be biochemistry, it could be emotional or spiritual, and it can be electromagnetic.
Yeah. Yeah. No, I like that. So, well, I have one last question. So after so many decades, in this work, what gives you the most hope about human health right now?
Um, I don't have a lot of hope right now.
No.
I don't. I don't. I could say something cute, but I don't.
Really? Okay.
People want the shortcut. Tell me what to take so I can feel better and keep living the lifestyle I'm living. That's what most people want. And that's going to continue to increase the amount of autoimmune diseases, the amount of suffering, the amount of miscarriages, the number of kids with autism. 1 boy in 12 in California is on the autism spectrum. 1 in 12. Society can't function with statistics like that. We have to think differently. You have to change the paradigm of how you think. Those that are willing, who say what you've said, well, this is like simple and common sense. That's exactly right. And if you become comfortable with these concepts by thinking about them and reading a little more or watching Betrayal or watching the Inflammation Equation, the other docuseries I did. They're on my website. They're free. But when you watch these docuseries where I interview the world experts, and then you're driving down the road in 3 days from now or 4 days, wow, I wonder if I have leaky gut. I should check for that. That you start thinking differently. And when you start thinking differently, you start coming up with different answers as opposed to, well, tell me something I can do now to feel better. No, No, you have to think differently. And as a host of a podcast, it's always nice to end on a nice note, where empowering note. No, society is dying. I mean, I hate to say this, but we can't survive with the amount of infertility and the amount of autism. And I mean, we didn't even talk about how toxic pregnant women are and dads, and how that is affecting babies' brain development in utero. So babies' brains are not developing the way they should completely. The result is more autism, more anxiety, more schizophrenia. I mean, the numbers are going up and up and up. And we're just blindly saying, well, what can I take to feel better? Wake up. Excuse me, but wake up.
Well, and that's why you spent so many decades of your life educating people.
That's right. And that's why you do this podcast.
Right.
That's why you do this podcast, is to help wake people up.
Yeah. No, and of course, I appreciate it. So you're full of knowledge, and I love your passion, trying to help people to wake up, as you said. So
yes.
And I really feel honored that you were able to come and enlighten us. So please tell us again the resources you have mentioned. So we will list them, of course, in our episode description, but some listeners might just want to hear it.
Sure. Yeah. The website is thedr.com, thedoctor.com. And there you'll see the education we have. We have the Gluten Summit, where I interviewed 29 world leaders about gluten and about celiac disease and about how wheat causes so many problems. And we have Betrayal, the autoimmune disease solution. They're not telling you that I went to 7 countries and interviewed over 60 world leaders. This is all free. And then we have the inflammation equation. All about inflammation. It's the one we did last year. It's had hundreds of thousands watch it now already. I mean, we get letters most every day, emails, say, thank you so much. Finally, this makes sense. Or I applied these principles, and within 3 months, oh my God, all of my symptoms were gone. You gave me my life back. I mean, we get these emails day after day, which is wonderful and just keeps me going. To say things like, wake up. Wake up.
Yeah.
Wake up.
Exactly. And I hope our leaders, our politicians, our industry leaders, so also will wake up.
Only after someone in their family is sick.
Exactly.
That's unfortunately, most people have to get sick before they're going to change how they think.
Yeah, that is unfortunate. But we just hope that we all will wake up and learn more. And thank you for sharing your resources. And thank you so much for being here, Dr. Tom. So
thank you, Dr. Irina. What you're doing with this podcast, I call it boots on the ground. You're carrying the message out to the world, and that's really, really important. And the people that listen to you are receptive already, because they're listening to you. So they're receptive to this. So it's a pleasure to work with you. Thank you for the opportunity.
Oh, thank you so much. Yeah, the knowledge is power, as we know, right? So, and thank you for joining us at Cures, Remedies, and Beyond, exploring science and the wisdom of health and healing. We hope to see you next time.
This podcast represents the personal views and opinions of the host and the guests and does not constitute medical advice. The statements contained in this podcast have not been evaluated by the FDA. Any products or treatments mentioned are not intended to diagnose, treat, or prevent any disease. Cures, Remedies, and Beyond podcast with Dr. Irina is bringing together the science of medicine and the art of healing for ultimate vitality and health.